Patrick Commiskey in Albuquerque, New Mexico. This is an interesting cataract in a patient of appropriate cataract age who happens to have Axenfeld-Rieger syndrome, um, at least just the ocular manifestations. So you can see that he has the iris thinning. There's a anteriorly displaced Schwalbe line, the posterior embryotoxin, which is difficult to see here. It's actually right about where my main incision is. You can see it best at the very beginning of the video. Um, and a bit of ectropy and UVA as well. There's no PAS in the trabecular meshwork. There's no issues with the pressure. The optic nerve looks normal. Um, and it's also just sort of a beautiful looking iris. Uh, so I decided to try to go ahead without any kind of Malyugin ring or iris hooks. Part just because I didn't want to mess with this guy's very thin iris and make some transillumination defects. So we're just kind of taking our time, doing our usual chopping maneuvers and getting these little pieces out. You'll see at one point I barely touch the iris, and there ends up being a very small transillumination defect. But just goes to show just how incredibly delicate these irises are. All the blue irises are delicate, but this one in particular, just very thin iris. So things are rolling along nicely. Now for our lens, we have Bausch & Lomb's ETE Toric lens. Very nice optics and unfolds really nicely. So that's the end of the case there. You can see where I barely touched the iris at one point, but I don't think I'll notice too much. Still a beautiful iris at the end of the whole thing, and happy to be able to share this case with you guys. Thanks so much for watching. And I do tend to futz around a little bit at the end of the case, just making sure the pressure's perfect, the axis is perfect, and so forth. Yeah, thanks for watching.